A very warm welcome to everyone. As part of our Beyond Banking initiatives, HSBC for Startups, in collaboration with Innerhour, brings you an exclusive web podcast on one of the key themes of mental healthcare sector, mental health and well-being. I am Purvangi Shah, part of the business banking team at HSBC India, and I would be your MC for today's session. According to the WHO report 2018-19, India is one of the most depressed countries in the world. Even when the situation prevails, people who suffer from mental health concerns do not get the right kind of help. The healthcare sector is flourishing, and more people are realizing the importance of mental peace. If there's something that the pandemic has taught us, is that mental well-being and a positive attitude towards life is very crucial. And when I say that, I cannot stop appreciating a startup that deals so closely with this issue. Innerhour. Innerhour is a healthcare technology startup that has condensed the therapy experience into a digital self-help platform. The platform offers tech-led digital and multi-professional services to help bridge the access and treatment gap for quality mental health care in India. Innerhour scientific tools and features supports an individual on their journey towards a happier life. With that, let me take the privilege of inviting our speakers for the day. I first invite Dr. Amit Malik, founder and CEO, Innerhour. Dr. Amit Malik has over 2 decades of experience of working in mental health globally as a psychiatrist, senior clinical and professional leader, and an entrepreneur. Amit has held numerous leadership roles, including clinical director and associate medical director. He has played a critical role in building out and managing large multi-location mental health services, leading on national and international health policy initiatives, and driving technology-led innovation in his board-level roles in mental health organizations before moving back to India from the UK. Amit is also an extensively published author. He has co-authored, co-edited 6 textbooks and has routinely published in several international academic journals. Additionally, he has previously been an editorial board member of 2 international journals, International Psychiatry and the International Journal of Social Psychiatry. Welcome, Amit. Pleased to have you. Let me also invite the second panelist for today, Neha Kirpan, co-founder at Innerhour. For over a decade, Neha worked at the intersection of the creative and social sectors. A social entrepreneur and a global mental health ambassador, Neha brings tremendous experience in weaving impact networks with great passion and commitment to solve the mental health care gaps. An Aspen Fellow and Eisenhower Fellow, Neha was also part of the World Economics Forum Young Global Leaders Committee in 2015-20. She also bagged the NDTV Indian of the Year Award in 2018, Fortune Magazine's 40 Under 40 2015, and the coveted Business Today's India's Most Powerful Woman Award for 3 consecutive years. Pleased to have you, Neha. Welcome. Let me also take this opportunity to invite the moderator for today, Mr. Tapas Banik, who is the Senior Vice President and Startup Lead Mumbai at HSBC India. Over to you, Tapas.
Thank you, Purvangi, for that quick introduction. And it's my honor and privilege to have Dr. Amit Malik and Ms. Neha Kirpan today, the founder and the co-founder team of Innerhour. We have been talking to many startups. We have been doing various web podcasts, but this theme, when we started curating, there was one thing in our mind that are we really aware about what mental health is about? Do we really know what needs to be done? Do we really know where do I seek help from? And with these thoughts, I decided that we should have an important theme like mental health and well-being as a part of a startup journey for corporates. Basically, when we are seeing huge amount of startups coming up in India, the challenges which the startup founders face, the employees face, for a matter any organization today, is now dealing with this mental health issues. So today, I formally welcome Amit and Neha as a part of the panelists to discuss, to help us be more aware about this whole issue of mental health and well-being. Welcome, Amit and Neha.
Thank you.
Thank you very much.
Thanks. Good to have you guys. And I would want to directly ask the first question to Dr. Amit. Amit, mental health always has been a taboo factor in the society, whether it is Indian or just beyond the boundaries also. What is the primary reason for this issue? And are you seeing that pandemic has brought a change in the way people are now talking about or treating mental health? more seriously? What are your views on this?
Sure. Well, Kabas, first of all, thanks for having me here. So let me start by addressing the stigma issue, right? And the taboo issue you talked about. I think as human beings, we often demonize or vilify what we don't understand, right? Especially what we can't see and what we can't understand, right? And for the longest time, mental health and mental illness are things that have remained invisible at two levels, right? One, it's not something you can physically measure or touch and see in a way that you could probably measure diabetes or hypertension or an injury, like a physical injury, right? And secondly, as a society, we're often hidden down or sort of suppressed individuals with mental health difficulties. So both you can't see the physical symptoms, but also then you don't the individuals don't seem visible to us. So then it becomes like a problem that's happening elsewhere. It's not a problem that happens to me, right? Whereas statistically we know that 1 in 4 people in the world will have a mental difficulty in their lifetime, which means that at least one and a half of us on this call statistically will suffer from a psychological difficulty in our lifetime in that respect, right? So it is not a problem that happens out there. It is a problem that happens to all of us, to our families, to our friends, and from time to time we have to address these problems as we would with any other health issue, right? But the lack of awareness, the lack of visibility, the lack of conversations around it often leads to sort of a taboo being created of something that's sort of a bit unknown. I think what also doesn't help is the large treatment gap, right? So, when, for example, when you look at many health conditions that have evolved over the years with very significant treatments, the taboos come down, right? So going back in history, many diseases that were tabooed. I mean, even things like diabetes, even 100 years ago, there was no real cure. So as cures have become more commonplace, as treatments have become more common, diabetes doesn't have a cure, but treatment has become more commonplace. Right? It's become easier to accept and acknowledge that this is a condition that can happen to a lot of us. I think similarly, we're on this journey with mental health and mental illness right now, where there is a huge treatment gap and a lot of people don't actually get access to help. That number is 95%. So let's just pause and think about that for a second, that 19 out of 20 people who have a mental health difficulty that requires treatment don't actually get that treatment in this country, right? And therefore, because it's not something that obviously gets treated for most people, then it again remains an unknown entity, and then that creates a taboo around it. So my belief is that as these conversations happen more in the open, as people start sharing their experiences, which they have now, and as treatments become more commonplace, the taboo will come down, is already coming down. I mean, statistically, if you think about the last few years and even pre-COVID, we were seeing a trend towards more acceptance, more awareness, more open conversations around mental health. And what COVID has done is just accelerated that journey, right? So if you go back and think about the challenges of poor awareness and poor public conversations, I think the public discourse in the last 18 months has changed tremendously around acceptance, around awareness, around solution seeking for mental health difficulties. That was probably not the case about even 2.5, 3 years ago, right? And just to sort of fall back on some of the things we've seen within our organization, right? On our app and on our platform in the last 6 months, we've almost seen a 7 times increase in monthly downloads, right? We've seen 11 times the number of people tracking their symptoms and mood than used to even 6 months ago, right? We've seen a 4x increase in therapy bookings, and I can go on and on so on about that. That's on the individual side. But you mentioned even employers, right? And corporate engagement and employee engagement. We are seeing about 9 times the employee engagement now than we were seeing even 6-8 months ago, and about 4 times the therapy bookings, right? That people are booking therapy sessions, that number's up 4 times. And it's across sectors, right? It's IT, ITES, media, BFSI, all of that sort of engagement has gone up across sectors, and almost 5 times increase of requests. What has changed is that about 3-4 years ago, you would have a conversation with an organization trying to tell them why they should support the mental health of their employees. Now the conversation is about how and what rather than why. Right? The why is no longer a question anymore. Right? Everybody, and what we are seeing is that there's inbound requests, right? Both for our pro bono programs that Nina launched during the pandemic to support the mental health of organizations through the IS-21 program, And for paid programs, we've seen a 5x increase in sort of inbound requests than we were getting even 6 months ago. So I think both on the individual side and on the organizational side, that this course is changing very rapidly. And I think the big reason for that is that the emotional struggles of many individuals have sort of bubbled up and become more obvious and apparent. And I think when things become difficult, we care less about taboo and stigma and care more about sort of finding solutions. And that's the more individuals and organizations are in right now from that perspective. So I'll just pause there. I think I've
Yeah,
hopefully answered your question.
Thanks for those insights, Dr. Amit. I was actually, while curating this, I was actually looking at, a couple of fact sheets, and I was really, surprised. I would say I was shocked to, see, because these were like eye openers that, as per the World Health Organization, 7.5% of Indians suffer from mental issues, and what I hear is that this number is going to likely go to 20% in a year's time. It's a serious challenge in front of the society, in front of the corporates, in front of everyone, right, as an individual. And I also understand that it's estimated that 56 million Indians are suffering from depression today. I think the COVID would just add to that number. And not only India, if I look at a much more developed nation like United States, I understand that 35% of people have a serious mental illness in US and they are unable to receive a treatment. So this is become, I would say, a global issue to be tackled, because this is more personal to everybody and probably needs to be addressed. Maybe Neha, I want you to just come in here. You being a social entrepreneur and also a mental health ambassador, which are the key areas you are constantly working to solve this mental health gap crisis today, which Amit also just alluded on?
Thanks, Tapas, for sort of bringing this topic to light and also talking about the importance of mental health at a broader society level and at a broader sort of business and economic level. Because, as a social entrepreneur, Amit and I, one of the first things we feel is that mental health is sort of the bedrock of many other aspects of society as well. You look at education, you look at your work life, you look at so many aspects of life and welfare, and mental health goes alongside all of that. When you look at the COVID-related issues and you look at other physical ailments, we know that there is a lot of comorbidity with mental health conditions. So whether it's cardiac issues or hypertension, diabetes, they all have a mental health comorbidity. And so with that, you're talking about a much broader population level problem. Some of it is expressed and going in for treatment and solutions, and some of it just lies, as Amit mentioned, 95% don't ever get help. So it's very important for us to try and bridge this gap in some way or the other. The first thing really is to be advocates and find advocates, right? So to be able to build communities of people who are all being ambassadors, coming from a clinical perspective, coming from a lived experience perspective. And it's really the normalization of that conversation. As Amit mentioned today, people don't look at it as a choice. People look at it as a need, that we have to have mental health support for our employees. In fact, the trend we've seen is that most of the organizations today are seeking the programs not just for employees, but also for their family members. So it's a time of going one step beyond. And organizations, instead of looking at the more obvious of saying, let's increase productivity, they are looking at the longer term impact of all the grief and the turmoil and anxiety people are going through, and saying, let's really be a supportive organization. Let's be a good place to work. Let's do the right thing. So I think the conversation around this in corporate circles, in influencer circles, in organizations that do not normally talk about mental health. I mean, we've done leadership talks with teams at some of the top multinational corporations, top business organizations like ASOCHAM and FICCI, and so really bringing mental health into the mainstream so people can understand how to go about solving for it. And the important thing there is to recognize that there isn't a one solution fits all. So mental health needs and problems can be defined in very specific, personalized ways. And so a lot of the approach that Innerhour has taken is to personalize and almost decode people's journeys and help them in a way that works for them, which means they do it at their pace, they do it at their convenience. So the step care approach gives people the option of taking whether they want therapy or they want to work on a self-help app. We'll talk more about that. The idea is to be able to create a universal offering that people can activate, but yet it's personalized so that people are able to make the best use of it. And so those are really some of our priorities: to build conversations, build communities, be advocates and create ambassadors, and really work on making accessible the mental health solutions that are required, except not one dimension, but looking at them in this sort of multiple offerings kind of bouquet, so that each one can see what works best for them.
Thanks, Neha. Quite insightful there. Maybe let me go to Amit. I think Neha just spoke about the entrepreneurship. And I'm really curious to know, Amit, about your journey, because you being a doctor by profession, psychiatrist, you're an author, right? And what made you actually look at startup? In fact, you could have actually had your own clinic or a hospital, or you could have created a brand. Why a startup? Why you started? And when you, especially when I talk about startups, I think the word should be the new age technology companies. So why a new age technology company? How do you think that this journey from being a doctor to this a founder, was it smooth? Was it you had a bed of roses because you already know about this subject? Was it easy for you to drive, or was it really a challenge because the subject which you're dealing today with Innerhour is needs a lot of attention, needs a lot of push to familiarize people about what Innerhour is?
So it's a great question, I think. So there's a personal element to the answer, and then there's what's happening in the sector and the space. So let me address both, hopefully briefly. So I think at a personal level, I'd been managing large systems for a while, right? I'd been managing mental health services beyond just my individual practice for a significant period of my sort of trained career, right? And so this was not a big leap to think about systems and a systems approach to a solution that was beyond my practice from that perspective, right? I'd managed a large sort of clinical team, large number of clinical teams in my last role and the role before that, and we, we'd seen a couple of obvious challenges, right? One was that by the time that users showed up at the door of specialized services, they had waited for a long period of time. Right? So even in India, for example, the median time for somebody who finally accesses a mental health service is about 6 years from first experiencing a symptom. That's a long period of time, right? And so that was the experience we were having on the other side when you were running services. You then end up seeing patients who've actually suffered for a long period of time with the health cost, the economic cost, the relationship cost of that alongside. And frankly, from a clinical perspective, it's just that makes it harder to treat these individuals because the prognosis is poorer. It takes higher doses of medication. It takes longer periods of therapy. All those things become harder when people show up there. So that was one problem. And then in the last couple of years before sort of moving out of my sort of set career, I worked with a whole bunch of technology companies. The idea was I was on the board of this organization. I had a commercial and innovation role there, and so in that context, we partnered with a bunch of technology companies, it was quite heartening to see even smaller companies, these were still Series B, Series C funded companies that were still, and this in the UK, London ecosystem, they were still generating a lot of engagement and outcomes compared to what I had seen being conventionally delivered over a period of time for a very large number of challenges. Because one of the challenges was early access. Then was how do you engage somebody in an ongoing manner, in addition to the episodic sort of contact they have with professionals. So, and then how do you sort of support their families? How do you provide them the right content, the right programs? So, a number of challenges that were available, that were present, that were leading to some of the poorer outcomes. I was seeing this technology company solve, and then it became not a very hard decision to then think about saying, how do I look at this from a systems approach? How to look at this for the Indian market? And so I moved back to India about 7 years ago now and started the company. That's the personal answer. So it was a decision driven by a whole lot of experience and interaction that led to it being a natural conclusion almost, rather than it being a very tough choice from that perspective. On the system side, you asked the question about, was it a bed of roses or was it hard? It was a combination of both, right? So one amazing thing about this space is it's got a lot of well-wishers and champions. right? So what you then start seeing is a number of people stepping up and wanting to help and support in multiple ways, and we saw this through people initially supporting us with a number of logistic issues and initiatives over a period of time, right? Whether it's investors, whether it's partners, whether it's people who come and work for us, right? I see everybody who's come and work with Neha and me is taking a big risk with their life and careers, like coming to work on early stage venture. So all these people have a lot of them come with the view of mission of solving things. So that's been a great support. I think the challenging part was to unlearn everything I'd learned before, right? Not unlearn psychiatry and mental health, but unlearn the way things are practiced, right? So unlearn to basically start looking at things from the user's perspective, right? And start focusing on saying, how do we really solve this problem in the context of how the user and their family are experiencing it, right? So really trying to approach the solution development through a whole bunch of user conversations, user data, user feedback, and trying to iterate a business and a product model that is distinct from how things are practiced traditionally, while still staying true to traditional science, right? So there's still staying to science and evidence-based clinical practice, but then looking at how we could actually iterate how we, let's say, initially engage people, or how we try and retain people over a period of time. How do we drive outcomes by doing the other things well, in addition to doing the science and the clinical practice well from that perspective. So I think that was hard initially, and I think things have gotten easier over a period of time from that perspective.
Fantastic journey. So I think Neha, this is for you. This question is for you. In fact, because you're also a social entrepreneur, you work very in close circles with NGOs and healthcare workers, frontline workers. In fact, the bankers were also frontline workers during the COVID time. Just want to understand. I'm sure that this pandemic has actually taken a big toll on the mental health of healthcare staff, also healthcare / the frontline staff also. So how is a healthcare company like Innerhour solving this problem?
It's really important, Tapas, to recognize that those who are out there to protect others are sort of severely putting themselves not just at risk, but also have burnout and fatigue and anxieties. There is a lot of guilt, whether it's guilt about perhaps bringing an infection back home to family members, or guilt about not doing enough. And all of that takes a toll. And we must recognize that there is an immediate toll, there is a midterm and a long-term effect of this. So there is a PTSD kind of impact as well in some cases, and really we have to be able to be as supportive and aware of that as possible. So at Innerhour, we've done 2 or 3 things. When the lockdown started last year and the pandemic just about kicked off, we recognized that healthcare organizations, NGOs, don't have the means and the wherewithal to get mental health support. So we decided to take our entire digital offering and make it pro bono for all of these organizations. And the IS21 program that we started last year, we actually brought out the 2nd edition of that this year, unfortunately, in the 2nd wave of the pandemic. Each time we've seen a huge uptake of organizations who otherwise would not have been able to provide for that kind of support, because the time just isn't there. The resources aren't there to create therapy support and so on. And also, it's just logistically harder for the healthcare practitioners while they are going about their business. But so we saw a lot of sort of successful uptake of the IS21 program from organizations across the board and across India. And also then recognizing the sort of need for therapy for healthcare workers, we launched a Mind Care Plus program. And this is supported by Godrej. There are lots of corporates and organizations who've come forward and said they want to join us in an alliance to be able to work for healthcare workers. And so this particular initiative offers pro bono therapy in 8 local languages to healthcare workers across the board, pan-India. And another sort of effort from our part to be able to work across the sector. In addition to that, we're also the self-care providers for the first responders first in the US. This is a tie-up in collaboration with Harvard University. And there's been an extensive series of content and adaptations that we've done on our platforms to be able to support COVID-specific relief. And so whether it's digitized programs, whether it's in, things that have been included in our chatbot and support system, or webinars dedicated to various COVID-related themes. So we've looked at grief, we've looked at burnout, specific topics that are of particular concern to those who are really sort of feeling the brunt of it. Those have been some of the efforts. I know we're a long way off, but I feel like if we're able to help everyone know that there is the need for support, that it's okay to get support, and if you were willing, then what is the kind of support that is available? And then it's our job really, and other organizations who are providers like Innerhour, to be able to make it as seamless, as continuous, and as accessible as we possibly can.
Hey, thanks, Neha. I think it's really important to create that awareness. And the more the people are aware about this issue, the more the people will be able to deal with it. I'll just take a step back, and I was just talking about on this theme. I was talking to a few of my colleagues. As a bank, as an HSBC, as an organization, we have invested on this mental health aspects, the well-being of staff. In fact, we also have our employee assistance program available handy for the staff as well as the immediate family members. And in the last 2 years, in fact, in the last 18 months, in fact, the support which we got on from this employee assistance program has been tremendous. The tie-ups which we have with a couple of similar health tech platforms. Also, we have started something called as a mindfulness. It's something which we want to talk more about in the organization. So on that front, Amit, in fact, today I see, especially in the corporate world, especially in the startup side of it, there's a lot of anxiety, depression, there's a fear of loss. These are quite key themes which actually pop in when you actually have a conversation. Especially when the companies are growing at a super fast rocket speed, it's really a matter to be dealt with. And then how do you think today technology is playing its role in enabling health tech companies like Innerhour solve these problems?
So I think there is. Let's just talk about what we are doing, right? That might give you some sense of how technology can play a role at multiple levels, right? And especially in the groups that you talked about. I think there is 2 or 3 early insights that we sort of arrived at when we started talking to users maybe 5 years ago. And one big insight was that most of us, in terms of our health-seeking behavior, don't necessarily go and see a professional as the first interaction, right? And often we are not, and when it comes to mental health especially, we are often not sure of whether there is something wrong with us, and whatever is wrong with us, does it require sort of more professional intervention? I think so. Based on that, we developed the Innerhour app about 3 years ago, and the idea was to say, how do we take the best clinical practice and best scientific principles and personalize them for each individual user in the form of a program that they can consume on their own on a daily basis, right? What we learned from users was saying, that is the first step. A lot of them, I want to try something on my own. And then if it doesn't work, I'll go and speak to somebody. And what we learned was if we help users try the right things, for some of them, it will be sufficient help from that perspective. And they come back and use the program on a daily basis. They do a new psychological activity that's based on cognitive behavioral therapy, mindfulness, or positive psychology. And having learned some new strategies, they then practice them and turn them into goals and habits, right? So that journey really helps individuals have the symptoms improved. And for some, that might not be sufficient, which is where they would then have the option of seeking extra help through trained psychologists and psychiatrists on our platform, right? So and when they do that, how do you then standardize that delivery? Where for a particular condition, we are working on a set clinical protocol that's been developed by sort of highly trained experts, and then that's delivered to individuals during their therapy sessions or during the psychiatry program that they undertake. Right? And then how do you bring it together? How do you bring therapy, psychiatry, and self-care together? Is on a technology platform. So the first step, as I said, technology is being leveraged to provide evidence-based, personalized self-care that's available through frictionless, seamless access 24/7. The second is then the option of somebody who wants to do more is the availability of psychology on video, voice, and chat. It's available now across a large team of therapists across this country, where we have therapy available in 8 languages. and over 120 therapists on our network. And then psychiatrists were highly trained and work within an hour to provide the right kind of medical advice that's required. And again, though they're accessible through video, voice, and chat, and are able to sort of review and treat patients sort of remotely now. So that's the top level of the technology. And then the technology becomes very important to help people stay engaged and work on themselves in between sessions when they're taking therapy, allow them to take assessments. Gradually, we'll be launching a platform which allows them to be part of a community, right, where they can sort of provide peer support to each other and learn from each other's experiences. And that has been shown in clinical science to improve outcomes and help people stay better, right? And then allow an easily access point if things start getting difficult again for somebody who's recovered, right? So across the lifetime of the user and or somebody struggling with difficulties, the technology platform can help them both early access, more robust clinical interventions, and then again sort of helping them stay better after that once they've recovered from their condition, that perspective, right? So that's the broad sense. And besides the program, there are multiple things that help you do that. We have trackers, journals, chatbot that engages with you on a regular basis. So there are multiple features on the program that help you sort of stay engaged and work in a way that is more personalized to you and that works for you from that perspective. So I think that's some of the broad things that technology is sort of helping us do today, which might not have been possible 5 to 10 years ago from that perspective.
Oh, great. Good to know that. And in fact, I also read somewhere that the global wellness market today is worth $1.5 trillion, and this is growing at a 5 to 10% CAGR year on year. So it needs startups like you to in fact come forward, the health tech startups to come forward and actually deal with this issue. I think we are closer to the end of the session. So I think my last question to both Neha and Amit. I think two things which you would recommend for startup founders or co-founders or anybody in an organization. What are the two things they need to practice so that they bring that a real happiness into their work? What are the two things they need to practice?
I'll let Neha go first.
Yeah.
I think to be able to find a problem that you're really passionate to solve. It doesn't matter how big or small, but something that you're willing to throw your life and time at in an unending sort of way. I think finding that and then aligning it with what your strengths are, and having the humility. So the second point is having the humility then to bring in the others that are needed that complement your strengths. Because we can't do everything on our own. So I think both of those are sort of really key, and it's something that we very strongly would suggest.
I think I would just echo the first point especially, right? And Neha's very good at, and has been quite a good reminder from time to time in saying that let's keep the big picture and the user in mind. Right? Because sometimes it can become about numbers and investors and a number of other things, which are all very, very important. But I think as long as we keep the end user in mind constantly, and that's sort of making the point that having a goal that really is bigger and beyond just the organization, and then sort of staying focused on it really helps from that perspective. I think the other two things I would kind of add is one is really around trying to find your balance in terms of self-care, right? Because especially last year and a half, I've known a number of founders. We've had difficulties ourselves in managing a team remotely and with not knowing what tomorrow's going to bring, so self-care becomes very important, because only then can you look after everybody else in the organization, and then only then can you look after the clients from that perspective. So having a routine that allows you to manage your day in a way that works for you and your family is very, very important. I think the second thing is that accepting that uncertainty and change is the norm, right? So when you take these decisions that of starting a company, the fluctuations just become part of the daily life. And I think accepting that and not resenting it really helps smooth things on a day-to-day basis, essentially.
And thanks, Amit. I cannot agree more. Change is the new constant, and with a lot of humility. I would strongly recommend all of viewers who have actually taken the time out to hear this topic from the two stalwarts in this industry. Please do take self-care please focus on your emotional wellness. Thank you, Dr. Amit. Thank you, Neha, for joining us for this session. And it was really a great topic for us to talk. And it was really insightful. And I am now fully aware that how important mental health and well-being is for individuals. Thank you so much for joining us.
Thank you, Tapas. Thank you so much. Neha and Amit, thank you so much for sharing your thoughts and taking us through some interesting facts and insights today. The conversation helped us go deeper into the segment and understand it in more details. The topic itself feels so personal and relatable. I'm sure the viewers would find it as insightful as it was for me. Thank you so much for being a part of this podcast. And with that, I mark an end to today's session. Thank you so much, everyone. Have a great day.